So if the goal is to provide clinicians with an electronic health record tool that they want to use, what are the attributes that need to be within that tool? These are 5 observations of high-level attributes that I've put together from having worked alongside clinicians over the last decade. And these 5 attributes, though, I want to point out, are not features. When you look at a lot of survey data about what clinicians want, you're primarily looking at feature lists. This is a much level higher abstract than that. And so the 5 are useful, easy to learn, reliable, trustworthy, and secure. Just a few words on each. For something to be useful, if clinicians really don't find that the EHR tool makes their immediate work or their future work better, there's little desire to adopt it. And of course, the opposite is true. If they perceive that the tool is burdensome or creates additional work without real benefit, they're going to strongly oppose adoption. This is kind of common sense. The second, on easy to learn, clinicians are very busy, and many dislike training sessions for computers. And in a clinician's mind, time spent doing training is time taken away from patient care and the many other obligations that they already have. And so therefore, training will always be ranked mentally lower on the priority list than their other work and obligations. And therefore, that's why it needs to be kept to a minimal. So it needs to have an intuitive and easy to learn software in its interface. 3, reliable. A product must regularly work as expected each time it is used. If the product works well some days and poorly other days, this causes a lot of frustration. And so, for instance, this means that the EHR tool may need to function in settings of unreliable internet connectivity or unreliable power. Number 4, trustworthy. Clinicians must have trust that the data the EHR provides is true. For instance, this means that both the data needs to be accurate, meaning that the numbers displayed on the screen are actually the numbers. And second, this also needs to mean that the data shown is up to date. If clinicians believe that new lab results may be available, but there's a delay of it entering into the system, they won't trust the EHR to reflect reality. And number 5, secure. Clinicians want to know that the tool they are using will protect the patient's data, and this is both out of good intention to respect patient confidentiality, but also because clinicians do not want to get in trouble for using something that violates their local data laws or to experience data loss. When you look at these 5 items, which one is most important? Well, it's almost certainly the tool needs to be useful, because if the product is useful, clinicians will tolerate much lower performance at the other high-level attributes. So what makes an EHR useful? Well, the next post is going to discuss how usefulness can be divided into both immediate and delayed benefits. And of course, if you have ways to expand this list or key attributes which are missing, please let me know. I'd love to add them.